আচ্ছা, এটা ছেড়ে দিলে এখান থেকে শোনা যাবে না? না, এটা ডিসকানেক্ট করে এমনি।
স্যার আপনার মাইকটা মিউট হয়ে গেছে।
হ্যালো, হ্যালো।
Yes, sir.
স্যার নমস্কার স্যার।
This, sir.
হ্যালো, আপনারা শুনতে পান? হ্যালো,
Yes,
হ্যাঁ
sir.
ভাই,
জি জি শুনতে পাচ্ছি।
জি স্যার শুনতে পারতেছি।
Yes, sir, শুনতে পারছি।
হ্যালো, শোনা যাচ্ছে?
Yes.
আসসালামু আলাইকুম স্যার।
Yes, sir.
জি স্যার শুনতে পাচ্ছি স্যার।
আচ্ছা, যাই হোক, এটা কি আসছে? না, এটা তো খুব ইয়েটা নষ্ট হয়ে যায়। হ্যাঁ? চেঞ্জ হয় কই?
স্যার মাইকটা স্যার আবার মিউট হয়ে গেছে স্যার।
হ্যালো, কি শোনা যাচ্ছে না? শোনা যাচ্ছে?
জি স্যার
Yes,
এখন
sir.
শুনতে
This,
পাচ্ছি।
sir. This, sir.
আচ্ছা, আসলে শুনতে পাচ্ছ তোমরা?
Yes, sir.
Yes, sir.
Okay,
Yeah.
okay. We'll start today with some of the basic principle এবং problem related to gallstone disease. You know, the stone is formed in our body in an area where there are formation, there are composition, or there are feasibilities of formation of the stone. Like a stone can be formed in the salivary ductal system, it is called pyelolithiasis. It can be formed in the gallbladder, it is called cholelithiasis. It can be formed in the bile duct, it is called choledocholithiasis. It can be formed in the urinary system, we call it urolithiasis, and it can be divided into nephrolithiasis, ureterolithiasis, cystolithiasis. So the formation of the stone is one of the common surgical sequelae in many of the diseases. And today we'll discuss about the formation of the stone in the gallbladder. So it is called cholelithiasis. Cholelithiasis means the formation of the stone in the gallbladder. হয়ে গেল। So before going into details, we have to know what are the common types of the stone that is formed in the gallbladder. বন্ধ করতে। So types of stone, one of the very common types is cholesterol stone. And this cholesterol stone is composed of cholesterol pigment, cholesterol, and it is usually solitary in number, having the smooth surface, round to oval in shape, and light yellow in color. So cholesterol stone, it is composed of cholesterol, and we can recognize the cholesterol stone by its single in number, smooth surface, oval to round in shape, and light yellow in color. If we consider only the cholesterol, then this is the most commonest type of the stone. But second type is the mixed stone. That is, in addition to cholesterol, other components are also present. It is composed of cholesterol, calcium, salt, bile acid, bile pigment, phospholipid, and protein. So in addition to cholesterol, here there is presence of calcium salt, bile acid, bile pigment, phospholipid, and protein. And they can be recognized. They are usually multiple in number, multifaceted due to mutual friction and formation of the facets, brown to yellow in color. So, welcome, Salam.
স্যার
Hey,
ওয়েটিং এ আছে
so mixed stones are composed of multiple constituent including cholesterol, calcium salt, calcium bile acid, bile pigment, phospholipid, and protein. And they are multiple in number, multifaceted, brown to yellow in color. And last one, nah, and the last one is pigment stone. The pigment stone, it can be recognized by its brown to black in color, and they are usually multiple of different size and shape. Some are smaller, some are larger, and some may be like sand-like. So pigment stones are of different shape and size, black to brown in color. They are again divided according to underlying etiology. The black stone, that is black pigment stone, and brown pigment stone. Both are brown in color. Now we have to consider why there is formation of the stone in some individual, other why I am getting this stone. We can observe the stone formation in the gallbladder that is much more common in a group of people who can be remembered by 5F gallstone. যাদের বেশি হয় definitely having other criteria that can be remembered by F5F. F for female, F for 40 or 50 years of age, F for fatty, F for fair, and F for fertile. So because of so many physiological and hormonal factors, you know, cholesterol metabolism is related to estrogen and progesterone, and estrogen and progesterone is present in female, and females are more prone to develop bile stasis because of repeated pregnancy. So in female, the incidence of stone is much more. Second F is 40 or 50. That is, the gallstone can occur at any age, but it is much more common in middle age of 40 to 50 years of age. And third F is fatty. It is much more common in fatty women, those who are overweight, having increased incidence of fat deposition. And fourth step is fair, and this is related to deposition of the fat. If there is deposition of fat, the individual looks usually fair. And lastly, fertile. Fertile means these women have the history of multiple pregnancy and multiple childbirth. And in each childbirth, there is incidence of the stasis of the bile because of the partial paralysis of the smooth muscle of the bile duct and mechanical compression by the developing fetal head. So gallstone is much more common in these people of female 40 or 50, fatty, fair and fertile. কি ব্যাপার? So what are the underlying exact etiopathogenesis? Why there is formation of the stone? In a single word, we can say the exactly we does not know, or there is no single factor that is related to formation of the stone. There is relation of multiple different categories for the formation of the cholesterol and mixed stone, and for the formation of the pigment stone. For cholesterol and mixed stone, etiopathogenesis is similar, and for formation of the pigment stone, etiopathogenesis is different from that of the formation of the cholesterol and mixed stone. So for cholesterol and mixed stone, three factors are related: metabolic factors, bile stasis, and infection. You can see the metabolic factors, that is, we know the cholesterol in bile with the formation of micellase with the help of bile salt and phospholipid. So in any way, if there is excess formation of the cholesterol, so cholesterol and mixed stone formation is related to metabolic factors, bile stasis, and infection. And for pigment stone, the factors related are hemolysis. শুনতে পাচ্ছ না? Hello,
স্যার স্যার
Yes, sir.
কেটে কেটে
can you
আসতেছে
hear
স্যার।
me?
স্যার
Yes,
শুনতে
sir.
অনেক প্রবলেম হচ্ছে স্যার, কেটে কেটে আসতেছে, শুধু নেটওয়ার্কের প্রবলেম স্যার।
কেটে কেটে আসছে।
স্যার
হ্যাঁ,
একজন
স্যার,
ওয়েটিং
ভুলে
এ
গেছে
আছে, স্যার
আসলে।
অ্যাকসেপ্ট করতে হবে।
Network problem. Waiting. So I try to go slowly. Etiological factors are hemolysis. In hemolytic anemia, there is early breakdown of the RBC, and there is increased load of bilirubin, and it might be responsible for the formation of the stone. Second is biliary stricture. That is, if there is narrowing of the common bile duct that leads to stasis of the bile, and it may be responsible for the development or formation of the pigment stone. Foreign bodies in the bile duct like stent, infection. Infection causes secretion of enzymes like glucuronidase that causes deconjugation of the bilirubin, and that is responsible for conversion of the conjugated bilirubin into unconjugated bilirubin. That might be responsible for formation of the stone. And lastly, parasite like infestation with roundworm. So in the etiopathogenesis, we see for cholesterol and pigment stone, the factors related are metabolic factor, bile stasis, and infection. And for pigment stone, the factors are different, like hemolysis of blood, biliary stricture, foreign bodies, infection, and parasites. Nah, কি করে? Nah, থাক। So I already tried to mention that in the bile, cholesterol phospholipid that is soluble but water insoluble. So solution in bile without the presence of bile acid and phospholipid. In presence of bile
স্যার কি লিভ নিছে?
ভাই আজকে ডিপার্টমেন্টের ইয়ার খুব প্রবলেম হচ্ছে মনে হয় নেটে।
তার কাছে
রেড
নেটই
সিগন্যাল,
খারাপ।
রেড সিগন্যাল ওই সাইডে।
the attachment. ঠিক আছে, কানেক্ট হয়ে আছে? আচ্ছা। Can you hear me?
Yes,
Yes,
sir.
sir.
Hello?
Yes,
শুনতে
sir.
পাচ্ছ? Okay. So whenever we conceptors, I already mentioned the in normal bile cholesterol, as it is lipid soluble chemicals, it cannot remain in solution. So for its solubility, there is necessity of formation of micelles in presence of bile acid or phospholipid. You know from your knowledge of physiology that they are arranged in a way that is bile salt is a polar particle with the head pointing outwards, that is the hydrophilic, and the tail pointing inwards, that is lipophilic. Whenever this micelles is being formed, these cholesterol incorporate at the central lipophilic parts, and the as a whole in this form of micelles. So cholesterol remain in solution in bile with the presence of bile acid and phospholipid. So in any condition where there is absolute increase of the cholesterol or absolute decrease in the amount of bile salt, this bile will be lithogenic in terms that excess cholesterol is. So there are some situations where the cholesterol absolute amount will be increased, like old age, female, obesity, fatty food, oral pill, and clofibrate therapy, one of the drugs which lowers the cholesterol, plasma cholesterol, by enhancing the excretion through the liver. So the cholesterol secretion will be increased in old age, in female patient, in obesity, after fatty diet, taking oral pill, and clofibrate therapy. So these are the situation where there is absolute increase in the amount of cholesterol. Contrary to that, there are situations where the bile salt secretion will be decreased, like estrogen, oral dissolution therapy that enhances the excretion of the bile acid. Ileal disease, ileal resection, because we know the main bulk of the bile salt is being maintained by enterohepatic circulation, that is, after excretion into the intestine, loss of total bile salt. But if there is ileal disease where the cholesterol, bile salt cannot, or ileal resection, the ileum is no longer available for reabsorption. In this condition, there will be loss of excess bile salt, fecal enteric flora, and cholestyramine therapy. So these are the condition where there is decrease in the absolute amount of the bile salt. So if there is a situation where cholesterol is increased or bile salt is decreased, so excess cholesterol will be out of this micelles formation and will go out of this solution and will make the bile lithogenic. Bile stasis. So we are discussing the etiopathogenesis of the formation of cholesterol and mixed stone. Here stasis and infection. In the bile stasis may develop after vagotomy because vagus nerve is somehow is responsible for motility of extrahepatic biliary tree. So after cutting off the vagus nerve, there will be relative stasis. Then after TPN, total parental nutrition, after giving the nutrition totally through the parental route, there is no secretion of the cholecystokinin, pancreazymin. So there is no motor function related to hormone that going to contract the gallbladder. And the pregnancy. In pregnancy, because of hormone, there is paralysis of the smooth muscle of the bile duct, and also because of the mechanical compression by the developing fetal head, it going to compress the common bile duct. So due to vagotomy, total parental nutrition, and pregnancy, there is possibilities of relative stasis of the bile, and that might be the responsible factor for formation of the stone. And lastly, infection. Whenever there is infection in the gallbladder, there is production of mucus or mucopus, or there is formation of dead bacteria or glycoprotein. All these material might act as a nidus or center on which the solutes can deposit to form the stone. So in this way, the infection can contribute. Infection can contribute by forming mucus, mucopus, all these things can act as a nidus or center for stone formation. Inter connection. আচ্ছা না, কি করবেন থাক 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 So under the pathogenesis of the gallstone formation, we already just mentioned that for cholesterol and reduction,
স্যার এটা পড়ানো হয়েছে স্যার।
সময় শেষ এই যে হয় না কি সময় শেষ নাকি হ্যাঁ so if we consider it goes stages. First
স্যার আপনার মিউট আছে।
স্যার আপনার মাইকটা মিউট হয়ে গেছে স্যার, শুনতে পাচ্ছি না স্যার কিছু। স্যার আপনার মাইকটা মিউট হয়ে গেছে স্যার। হ্যালো স্যার, আসসালামু আলাইকুম স্যার। আপনার মাইকটা মিউট হয়ে গেছে স্যার, মাইকটা আনমিউট করতে বলেন।
Sir, maybe your mic muted, sir. Please unmute your mic, sir.
জি স্যার, এখন ঠিক আছে স্যার। স্যার আবার মিউট হয়ে গেছে স্যার।
আবার মিউট is
স্যার এখন ঠিক আছে স্যার।
Now, sir, it's okay, sir. We can hear you loudly and clear.
hello
Yes, sir.
Yes, sir.
শোনা
জি
যাচ্ছে?
স্যার, জি স্যার।
জি স্যার।
আচ্ছা, so these are the steps of formation of the stone. First one is the super saturation of the bile. That is, bile will be lithogenic in terms of formation of the stone. That is, there will be disproportionate amount of the cholesterol in relation to bile salt. Either there will increase amount of cholesterol or decrease amount of the bile salt. That is supersaturation of the bile. And second one is the nucleation. In this situation, if gallbladder became infected with the formation of the mucus or mucopus or desquamation of the epithelium, or the bacteria become dead, it acts as a nucleus or center on which the stone can be formed. So second stage is the nucleation. Third stage is accretion. Accretion means on the nucleus, from the nucleus onto the nucleus. And these nucleus become aggregated together ultimately to form the stone, a sizable stone that can be seen. And all this process takes at least 6 months time to become mature, so that we can see the formation of the stone. So stone formation goes through this of saturation of the bile, nucleation, accretion, and stone formation. And it takes about 6 months time. So if the process is being initiated today, we can see the stone will be formed up. Picture of the cholesterol, predominantly cholesterol stone. Jodio cholesterol is usually solitary, but in mixed pattern where cholesterol is predominant, it might looks in this picture, that is, it may be multiple, but usually cholesterol stone is solitary. This is a typical cholesterol stone, yellow in color. And this is the typical mixed stone, multiple in number, multifaceted.
Sir, Assalamu alaikum. Sir, please accept. Some students are in waiting.
Hmm. So this is the picture of mixed stone. পরের পিকচারটা, হ্যাঁ এটা তো হলো এই পরেরটা। This is also picture of typical mixed stone, that is multifaceted, brown in color, and it is composed of mixed pigment. And this and next one. Good. This is a very typical picture of the pigment stone that is plenty in number of different shape and size. They are black in color. So we can recognize this stone cholesterol and the pigment stone is black in color. Cholesterol stone is a mixed stone, multi